Good day, everyone. I'm Tristan Timana, and we are Group 3, and we're going to talk about autism or autism spectrum disorder.
Before we dive into the topic, let us discuss the table of contents for this discussion. First, we have the etiology of ASD. Second, the prevalence of and incidence of ASD. Third is the signs, symptoms, and pathomechanics. Fourth is the types, course, and prognosis. Fifth is the management. Sixth is the existing support system in the country for persons with ASD. And seventh is the speech, language, hearing, and or swallowing problems that may arise in relation to ASD.
So, for the etiology of autism spectrum disorder, available scientific evidence suggests that there are probably many factors that make a child more likely to have an ASD. So, it includes genetic differences, differences in brain development or in brain function, and exposure to harmful materials or chemicals in the environment. So, available epidemiological data are conclusive that there is no evidence of a causal association between measles, mumps, and rubella vaccine to ASD. And also, there is no evidence to suggest that any other childhood vaccine may increase the risk of ASD. So basically, there is no concrete or solid evidence that can support or explain the cause of ASD for now. So for the prevalence and incidence, 1 in 160 children has an autism spectrum disorder worldwide, or 1% of the population in both US and non-US countries. Approximately 67 million people worldwide are affected or have an autism spectrum disorder. ASD 5 times more common among boys, 1 in 42 persons. Then among girls, 1 in 189 persons. And for the signs and symptoms, you can often observe signs and symptoms of autism in very young children, but sometimes they are not very noticeable, and they might not be recognized until school age or even adulthood. So basically, signs and symptoms may change as the person gets older, but there will always be challenges with communication, social skills, and for the behaviors. For the communication, a person with autism may have challenges understanding and using gestures like pointing or waving, understanding and using words, following direction, learning to read and write. But some children with autism read early but do not understand what they read. That's called hyperlexia, and having trouble with conversation. A person with autism may lose early words, be hard to understand, repeat words or phrases they just heard or they heard days or weeks earlier. Use a robotic or sing-song speaking voice. Talk very little or not at all. And use challenges behaviors instead of words or gestures to communicate what they want. And for the social skills, a person with autism may have challenges relating to others. It might seem like they are not interested in others or in making friends. So it might be hard for a person with autism to share attention with someone else and focus on the same object or event. Join in play with others and share toys. Respond when others invite them to play or talk. Understand how others feel. Take turns in play or in conversation, and make and keep friends. And for the behaviors, a person with autism may repeat certain behaviors, including hand or body movements, cry, laugh, or become angry for unknown reason, have trouble changing from one activity to the next, get upset by certain sounds, smells, or texture, like only a few only a few foods. So they like only few foods. Choose foods based on look or texture, and be interested in only few objects or topics.
Although there is no clear pathway of mechanism directed towards a simple pathogenesis and an established link to autism on the symptomatic level, but there are, however, several important theories like neural connectivity, neural migration, excitatory inhibitory neural activity, dendritic morphology, neuroimmune, calcium signaling, and mirror neurons, which appear to offer an explanation to how autism develops. But it seems probable that autism's neurodevelopmental defect is multi-domain in origin, rather in a single anomaly, and is hence distributed across numerous levels of study, like genetic or immunopathogenic, and many more.
Type, scores, and prognosis of autism spectrum disorder. There are three types of ASD. First is the autistic disorder. This is sometimes called classic autism. It is what most people think of when hearing the word autism. People with AD usually have significant language delays, social communication challenges, and unusual behaviors and interests. Many people with AD have intellectual disability. Second is Asperger syndrome. People with AS usually have milder symptoms of autistic disorder. They might have social challenges and unusual behaviors and interests. However, they typically do not have problems with language or intellectual disabilities. Third is the pervasive developmental disorder not otherwise specified, or PDD-NOS. This is sometimes called atypical autism. People who meet some of the criteria for AD or AS, but not all, may be diagnosed with atypical autism. These people usually have fewer and milder symptoms than those with autistic disorder. The symptoms might cause only social and communication challenges. Long before, it was five types of ASD, including Rett syndrome and childhood disintegrative disorder, but it was then reduced into three. In 2013, the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, redefined autism. AD, AS, and PDD-NOS are now replaced by the diagnosis of autism spectrum disorder. There is now a single diagnosis of ASD. For its course, the behavioral features of ASD first become evident in early childhood, with some cases presenting a lack of interest in social interaction in the first year of life. Some children with ASD experience developmental regression with a gradual or relatively rapid deterioration in social behaviors or use of language, often during the first 2 years of life. Such losses are rare in other disorders and may be a useful red flag for ASD. Much more unusual and warranting more extensive medical investigation are losses of skills beyond social communication. For example, loss of self-care. First symptoms frequently involve delayed language development, often accompanied by lack of social interests, odd play patterns, and unusual communication. During the second year, odd and repetitive behaviors and the absence of typical play became more apparent. ASD is not a degenerative disorder, and it is typical for learning and compensation to continue throughout life. Symptoms are often most marked in early childhood and early school years, with developmental gains typical in later childhood in at least some areas. A small proportion of individuals deteriorate behaviorally during adolescence, whereas most others improve. The prognosis in patients with autism is highly correlated with their IQ. Low functioning patients may never live independently. They typically need home or residential care for the rest of their lives, while higher functioning patients may live independently, hold jobs successfully, and even marry and have children. Some children with autism may improve at 4 to 6 years of age, especially those with mild autism who have been treated at an early age. These children who improve may be able to include themselves among their normal peers.
Now let's move on to the management of autism spectrum disorder. So, intervention during early childhood is really important to promote the optimal development and well being of people with ASD. So they are more likely to have major positive effects on symptoms and later skills. There is no known cure for ASD, but evidence based psychosocial interventions such as behavioral treatment and skills training programs for parents and other caregivers can reduce difficulties in communication and social behavior with a positive impact on the person's well being and the quality of life. So, here are the different treatment approaches for autism spectrum disorder. First, we have the behavioral management therapy. So, this therapy tries to reduce unwanted behaviors and reinforce or try to obtain wanted behaviors in a child. So, this gives tips to caregivers or family members how to deal with children who have ASD before, during, between, or after episodes of problem behaviors. So, behavioral therapy is often based on ABA or applied behavior analysis, which is a widely accepted approach that tracks a child's progress in improving his or her skills. So, there are different types of ABA that are commonly used to treat autism spectrum disorder, and this includes the positive behavioral and support, which aims to figure out why a child does a particular problem behavior. Second is the pivotal response training. So, its goal is to improve a few pivotal skills such as motivation and taking initiative to communicate. Next is the early intensive behavioral intervention. So, this is where professionals provide individualized behavioral instruction to very young children with ASD. And lastly, we have the discrete trial teaching, which teaches skills in a controlled step by step way. Next, we have the cognitive behavior therapy. So, this type of intervention focuses on the connection of feeling, behaviors, and thoughts. So, the client with ASD will learn how to know, identify, and change thoughts that lead to problem feelings or behaviors in particular situations. So, this therapy actually helps patients with ASD cope in social situations and better recognize emotions. Next is the joint attention therapy. So, clients with autism are really known to have difficulty in joint attention or the ability to share focus on an object or area with another person. So, this skill is really important in language and communication. So, that's why joint therapy focuses on improving these specific skills that are related to shared attention. An example is pointing, showing, or coordinating looks between a person and an object. Fourth, we have the medication treatment. So at the present time, there is no medication that can cure ASD or all symptoms, but some medication can aid in treating certain symptoms associated with ASD, usually in the behavioral aspect. So healthcare providers use medications to deal with these specific behaviors, like, for example, aggression or self-injury, minimizing the symptoms relating to behavior that disrupts him or her the opportunity to learn, allows the person with autism to focus on other things, including comprehending different information and communication. But remember, all medications carry risks, so seek advice from the child's healthcare provider to ensure safe use of any medication. Fifth, you have the nutritional therapy. So, for many reasons, people who have ASD, especially the children, may not get the nutrition that they need for development because they are, in other words, picky eaters, or they only eat certain foods because of how the foods feel in their mouth or how it smells. So, if there is a circumstance where the child does not have enough nutrients for him or her to develop, then it is best that the parents or the caregivers work with a nutrition specialist or a registered dietitian to design a meal plan for a person with autism so that the child will become healthier and grow into a healthy adult. Six, we have the occupational therapy. So, occupational therapy helps people with autism spectrum disorder to do everyday tasks by finding ways to work within and make the most of their needs, abilities, and interests. So, the goal here is to improve everyday skills which allow people with ASD to become more independent and participate in wide range activities. Seventh is the parent mediated therapy. So, this is where professionals teach the parents techniques on how to do specific therapies to their own child. So, this approach gives children with autism consistent reinforcement and training throughout the day for development. So, several types of therapies can be parent mediated activities. So here we have the joint attention therapy, the social communication therapy, and the behavioral therapy. Eight, we have the physical therapy. So physical therapy includes activities and exercises that build motor skills and improve strength, posture, and balance. So it's more focused on the gross motor skills of the child. Lastly, we have the speech and language therapy. So speech and language therapy is very important in autism rehabilitations. This helps clients with ASD hone their language and speaking skill, which results in the development of social skills and communication at home, school, or settings that the client feels comfortable in. SLPs can also help the person with ASD learn to use AAC if they need help communicating, especially the nonverbal type of autism spectrum disorder. Now we move on to the critical members of the management team. First, we have the speech language pathologist. They help with social communication skills for both verbal and nonverbal patients with ASD and can help nonverbal children and adults find and use the most appropriate means of alternative communication or the AAC. Next is the audiologist. So audiologist plays a significant role in describing and defining the communication and social interaction skills so often impaired in children with ASD, especially in audition. So they conduct hearing evaluation to patients who have suspected ASD. Next, we have the psychologist. They specialize in the assessment and intervention of children with autism, usually in terms of anxiety. So, psychologists use a range of techniques, including behavioral strategies, social skills training, and emotional regulation to help children with ASD cope better in their everyday lives. Next, we have the occupational therapist. They help patients of all ages to improve or maintain skills for day to day activities and well being. Next, we have the SPED teachers. They provide instruction and support and also facilitate the participation of students with disabilities in the regular classroom. Next, we have the nutritionist, which identifies any nutritional risk based on how the child eats, answers questions about the effectiveness and safety of nutrition therapies and supplements advertised for autism, and help guide the child on how to eat well and live healthy. Second to the last, we have a developmental pediatrician. So they possess training and experience to consider in their assessments and treatments the medical and psychosocial aspects of children and adolescents' developmental and behavioral problems. So they also work with ASD. Next, we have the physical therapist. They help children with autism more fully participate in daily routines at home and at school, acquire new motor skills, develop better coordination and more stable posture, and also improve their reciprocal play skills.
Medical precaution speech language therapy. So SLPs test the person's communication and social skills. They may talk with others to learn about the person's communication in setting like home, school, or work. Some people with autism are hard to understand, talk very little, or don't talk at all. SLP tests the person's ability to use augmentative and alternative communication, which is AAC, to help them communicate. AAC can include sign language, gestures, pictures, computer tablets, and other electronic devices. So all people with autism have social communication challenges, but not all people with social communication challenges have autism. SLPs can help figure out if a person has autism or social communication disorder. Knowing the diagnosis will help the SLP find the best treatment.
So now we're moving on to the existing support systems in the country for ASD. So this is very popular, the Hello Ako Budoy, and even though you're not particularly a fan of Philippine media, I'm sure you're well aware of this phrase and of this teleserye as a whole because it was one of the few mainstream media platforms that put a person with ASD front and center, shedding light on what it was like to live with the disorder. And of course, it came with its own set of very Philippine teleserye touch. It was still important in the sense that it gave attention to those with ASD and it shed a light on their experience, kumbaga. And according to the Autism Society Philippines survey in 2018, 1 in 68 children are diagnosed with ASD. And their existing support is House Bill number 6934, or the National Autism Care Plan Act, which was authored by Anakbayan Representative Tomasito Villarin. This bill advocates that the treatment of PWA should be as a person with disability, and it is defined under Republic Act number 7277. There should be a biannual epidemiological survey to determine the prevalence of autism in the country. And there is also the establishment of a national program for early screening and detection for autism. And then there's also the mandatory PhilHealth coverage. Now, if you're a person with autism, you were covered by PhilHealth na. And then there's protection from discrimination in all establishments like school, colleges, training centers, and other institutions. And in case of disasters or emergencies, that there should be no discrimination. That because you're a person with autism, you will not be rescued or part of, in any case, a rescue or emergency and disaster. Parang ganon. And then there's also the creation of the Autism Council of the Philippines under the DOH, which aims to implement a sustainable long-term Philippine autism plan. Now, for the next support system, there's the Autism Society of the Philippines, and this is the most prevalent and the most known. It is a national nonprofit organization, and it holds seminars and conferences that is designed for PWA's family and for the public. So it aims to spread awareness and advocate for a more safe environment for autism. Let there be discussion with it. And there's also two of their most known programs is the National Autism Consciousness Week, which is from January 20 to 26, and the Angels Walk for Autism. And if I'm not mistaken, when we were first year in SLP, we participated in this when we went to SM Seaside and we attended the mass, and then we went to the mall after and hung out with kids in the merry-go-round. Yeah, I think so. And then they have programs that are spread throughout the country with its workshop in response to crisis behavior. It's held in Davao City, Cagayan de Oro City, and Cebu City. The Autism Society of the Philippines, it's the most known and one of the only existing support systems, as well as the National Autism Care Plan Act that was established by House Bill number 6934. Okay, and let's move on to the next one. Is in relation to the ASD condition. So for speech, children with ASD who can speak, they often say things that have no meaning or relation to the conversation or conversation that's not convergent. They may repeat words that they have heard over and over again. This is known as echolalia. So immediate echolalia occurs when immediately after they hear something, they ulit it, like paulit-ulit nilang sinasabi yung narinig lang nilang salita. So next we have hearing. In hearing naman, delayed speech and language skills. There's learning problems in school, may issues with self-esteem kasi the child is unable to hear the what is being said and the sound. So hindi niya ma sa sarili niya, they are unable to match the sound of the word with the letter and how it is supposed to be said. So kasi walang connection, kasi hindi sila nakakarinig ng maayos or at all. Kaya meron silang delayed speech and language na learning problems. Issues with self-esteem din kasi hindi sila nakikipag halubilo sa ibang mga bata, or they're unable to play with other children because they cannot relate to them on a level that the children who are hearing are able to do so. So, kaya meron silang troubles with their social interactions. And yung vocabulary nila, it develops more slowly in children who have hearing loss. Kasi nga, hindi sila nakakarinig and hindi nila, parang nahihirapan silang mag-relate sa mga words and sa sounds nila itself. So, that's why. Next. Sa language naman, sa children na may language problems, they will have problems with meaning and rhythm of words and sentences. Kasi there is a disruption in their language learning, so mahihirapan sila with the meaning, the content, the form, and the use of the language. Next, for swallowing. So they often have dysphagia, problems for swallowing certain foods or liquids, or they cannot swallow at all. Kasi meron namang ibang children na they only want to, or they only feel comfortable eating certain foods and textures in their mouth, kaya yun lang yung gusto nilang swallow. And then others naman na pag mainit, yung temperature ng food pag mainit or masyadong malamig, they don't want to eat it, or there's some things sa iniisip nila na it's dangerous or scary, kaya ayaw nilang swallow. Yun, or meron talaga siya sa function nila. As is, nahihirapan silang mag-swallow kasi because of their um, anatomy ba, or sa parang they think na it's dangerous or harmful for them, kaya nahihirapan silang mag-swallow. And that is it. Thank you for listening to our presentation.